Good morning and welcome. I'm Steve Morrison from CSIS, and we're really thrilled this morning to be able to welcome our distinguished speaker, Jean-Luc Boutel from Medtronic. He's the Executive Vice President and Group President for Medtronic's International Operations, and I'll introduce him further in a moment, but we're delighted at this particular time to be able to host him here, and I want to express my special gratitude to Dr. Trevor Gunn, the Senior Director for International Relations at Medtronic, based here in Washington, who has been just invaluable in helping us pull this together and has been a great colleague and collaborator, and we look forward to continued collaborations of this kind. I also want to offer special thanks up front to Kaiser Family Foundation, who yet again has very generously agreed to allow us to hold this event here. Diana Rowland, the Senior Vice President who runs the Washington operations, Jennifer Cates, the head of the Global Health Program here and Senior Vice President, both very close colleagues and strategic partners for us, and we're very grateful to them for allowing us to be here today. This discussion that we're going to hear momentarily is very timely. The Non Communicable Disease high-level meeting scheduled for September at the UN is fast approaching. We've just had some important discussions at Davos involving Julio Frank, Ban Ki-moon, Margaret Chan, corporate leadership from General Mills and elsewhere. We have an April ministerial meeting coming forward and a series of related World Economic Forum working group sessions, civil society consultations, and the like. Medtronic has played an exceptionally important leadership role from the business side in attempting to use its intellectual, its political, its financial presence and interest in this issue area to try and move things forward. It has been instrumental in organizing the meeting scheduled in Boston. I believe it's next month, on the NCDs for the bottom billion, done in partnership with Harvard and Partners in Health. It took a very important step in making a $1 million commitment to the NCD Alliance, which became very critical in leveraging now a total of 7 partners on the corporate side in support of that alliance, but also, most importantly, getting that alliance stood up and getting it to help set some parameters for what is achievable. There are many diverse businesses that have an important relationship to the NCD agenda, and we'll hear more about that. Suffice it to say that businesses remain essential to finding durable solutions. The question is really one of how to get there, and that's something that we're hoping Jean-Luc will offer some insight into, because it requires dialogues, it requires organization and new fora. It requires some agreement around norms and guidelines and incentives, how to incentivize businesses to see the importance and to join in new ways. It involves voluntary initiatives. It involves more formal initiatives. It cuts across a spectrum of businesses. So how do we imagine a way forward in this? And Medtronic has taken this on. And we've seen a proliferation lately in the news of new initiatives: Walmart, General Mills, PepsiCo, Nestle, Coke, that have all contributed in pushing forward the notion of what is possible. But I think Medtronic needs to be commended and singled out for taking a stand early on, for taking the risks, and for showing this strategic leadership. This session is part of a broader effort by CSIS to put a spotlight on the private sector and private sector's leadership and engagement in promoting development and global health looking forward, and we're hoping to expand that work. We will be expanding that level of work as a center-wide priority in the coming year. This is a very important session as part of a series, a high-level series focused on the upcoming meeting on NCDs in September. We had Dr. Harvey Feinberg, the head of the Institute of Medicine at CSIS last week, February 2nd, to talk about the epidemiological and demographic basis for the shift, the NCD shift. Enormous, great turnout, great interest in that, and I think a good step leading to Jean-Luc's presentation. April 12th at CSIS in the morning, 9:30 a.m., we'll have Dr. Tom Frieden from CDC, Douglas Betcher from WHO, and others to talk about tobacco control and the status of the FCTC, the Framework Convention on Tobacco Control, the status of capacity building efforts in key countries, and how we can take full advantage of that looking forward into September to try and move that agenda along. We have Dr. Mirta Rosas, the Argentine epidemiologist who heads PAHO, coming to CSIS on June 28th in the morning at 10:30 to speak about the upcoming high-level meeting. And there will be others activities. I want to also commend the Global Health Council under Jeff Sturcio's leadership for picking this up in its annual conference in mid-June, among other things, the newly launched roundtable, and all of these things are helping to elevate the issue and move us forward. We did issue a paper today that we've shared with you in hard copy, a paper authored by Debbie Sidrar, Peter Piot, and myself. I want to express my special thanks to my two co-authors for that. Please take a hard copy. Here, it's available electronically on the website, and we deliberately keyed the issuance of that paper to Jean-Luc Butel's presentation here today. They are a good matchup in terms of the call for moving forward quickly right now. We're running a little behind schedule in getting preparations in place. There's still some missing pieces, but also some very promising developments of late. We need to define the boundaries. We need to package and deliver the key data to a popular audience. We need to be very realistic and focused around making use of those political assets like Margaret Chan or Ban Ki-moon, the NCD Alliance, which can move forward. And we need to have very clear, feasible, measurable, and finite goals that people can rally around. And I think all of that is very consistent with the general outlook that I think Medtronic and Jean-Luc Butel have brought to this debate, and we're benefiting from that. Jean-Luc, as I mentioned, is Executive Vice President and Group President for International Operations for Medtronic. His prior positions, he has had a career of leadership in Asia-Pacific region. He was president and previously senior VP for all activities in Asia-Pacific for Medtronic. He's had special depth and expertise in China, Japan, East Asia, and where these debates around the rising significance of NCDs are so central. He has a BA in International Affairs from GW. Welcome back, Jean-Luc. And an MA from the International Business School at Thunderbird. Please join me in welcoming Jean-Luc here today.
Thank you, Stephen, for your introduction and for framing the presentation that I want to share with you today. It's a pleasure to be here. I've, of course, heard many things about your organization, and to know that today and in the last few weeks and over the next several months, a lot of emphasis will be given to the topic that we're going to discuss today is very, very encouraging. And I say this because what we want to discuss today is such a broad topic, such a critical topic, that no one single organization, whether it's public or private, can really tackle the issue at hand. It's just too big, and some of the slides that I will present to you will put that in the proper perspective. At the same time, I do not want this to be a monologue, so yes, I will go through my slides, and I want to make sure that after that, and I want to make sure that the slides go on, by the way, I want to make sure that after that we have time to get the slides going. How do we do that? I didn't see it. Down here, Medtronic. This one? There we go. This one's pretty difficult to, you know what? Yeah. Here we go. I also understand that there are people that are probably following the presentation following the presentation online, so welcome to all of you as well. And let me just backtrack here on this. Very good. Sorry for this little deviation here. So what we're going to do today, I'm going to share with you thoughts around the agenda that you see on the screen right now, and then really turn the time over to you, Stephen, so we can have a dialogue, which I think is the more important part of the discussion this morning. One thing that I would ask that you allow me to do is do a little Medtronic propaganda, not because I work for Medtronic, but because I think the company in some ways represents a lot of what the private sector is doing, and the profile also of the type of technologies and activities that companies like us can bring to the marketplace. We were founded in 1947 by a gentleman named Earl Bakken. The key point that I want to highlight on these slides are the following. The number of scientists we have that are working behind finding therapies and solutions for people that have chronic disease, because that is really the core of our business, managing chronic diseases. The last bullet point on that slide talks about the fact that we have 25 therapy training centers around the world. To give you an idea of the scale, and that's a theme that will be repeated during my presentation, in the last 3 years, we have trained throughout the world, but more so in the developing markets. We have trained about 30,000 physicians, and on an average, if we take China, for example, we train about 7,000 physicians a year. The number may seem to be very high. Actually, it's just a drop. It's just a drop in the ocean. And one of the topics that I think we need to think of is how do we change actually the delivery of education for emerging markets on how do we manage better chronic diseases, because today it's almost doing it one step at a time. And when you look at the scale of the problem, clearly that is not enough. Just to give you some context here on these education challenges, and some of you may know these numbers, but in India alone, a country that is about the size of China from a population point of view, today you have actively practicing, you have 67 spine surgeons for a country the size of India. If you look at electrophysiologists, people that will implant, pacemakers and NCDs, actually practicing today in India, you have about 120 EPs. So when you look at the scale of the problem, it's not that we need to educate another 2,000. We need to find a way to deliver medical education, to open up access to those therapies in completely different ways. The Medtronic was really created with first a very, very strong mission, but we have a vision, and that first statement on the slide talks about that vision. I will read it. Creating a world where every person suffering from chronic disease who could benefit from our diagnostic, therapeutic, and disease management solution will get them. This is a very ambitious, well, a vision statement has to be ambitious in the first place. So this one clearly is very ambitious, but we really believe that considering the scale of the issue at hand, everybody should think in those terms, not just Medtronic, not just the private sector, because we're talking about hundreds and hundreds of millions of people that are affected by chronic diseases today. And then from our corporate citizenship statement, we want to catalyze a meaningful reduction in mortality and morbidity in chronic disease, and we have several programs in place, both in the U.S. and outside of the U.S. to do that. From the technology point of view, most of what we do are basically what I call smart implants, even though not all of the products that we sell to address those chronic diseases are smart. But by smart implant, I'm meaning products that have very sophisticated software and that actively manage a chronic disease. Okay. The second thing which is interesting is you could almost divide this slide into very few categories. One is what I call the combo products, where we use one of our devices to deliver a drug. Okay. And the other one is basically what I call the electrical signal segment, because when Earl Bakken founded the company, the whole theory behind the way we address chronic disease is using electricity, simple electrical impulses to treat diseases. And a lot of the disease states that you see on this slide use the technology of simply understanding electrical signals in the body and responding with an electrical signal to correct a chronic disease. Very simple to talk about it like this, very complicated, to manage otherwise. What we do also is, you have on this slide about 10 different areas where we have an impact, if you want, on the healthcare ecosystem, and whether it has an impact on the individual alone or it has an impact in terms of the whole healthcare system that we serve. There are several points that are very interesting, and whether you talk about slowing down the disease progression or improving quality of life, I want to attract your attention to the bottom right corner, allowing more efficient follow-up, remote monitoring and sensors. And this, if I could change that box, I would talk about the issue of connectivity. And connectivity will be a huge platform as we go forward, especially as we look at, how do we manage, chronic disease worldwide? Because, IT solutions will be a total part of the overall solution for managing chronic disease. And we still tend to think too much in terms of one device or one pharmaceutical pill, when we really need to think in terms of connectivity for managing this entire ecosystem. So I am done with my Medtronic propaganda here. I hope it was acceptable, and I will now move to really the topic at hand. So what are NCDs? I don't think I need to answer that question. We all know the broad reasons why we have these non-communicable diseases. Some of them are driven by lifestyle choices, and we see that a lot, particularly in Asia, where eating habits and living standards are changing so rapidly, and you see coming with that huge increases in some chronic diseases. Diabetes, I think, to me, is the most obvious one. If you take India, roughly 60% of death by the year 2020, if I recall the exact year, will come from cardiovascular diseases, which is, you think about it, it's an incredible number. If you also look at how people think of NCDs, there's a lot of misunderstanding out there. And one of the reasons why what we're doing today and what we want to do all the way leading to the UN summit in September and beyond, it's really a huge effort in educating people around the reality of NCDs, because, of course, misunderstanding leads to either bad dialogue or poor solutions, which nobody can afford. So I think a huge part of a forum like this one, Stephen, and going forward is to make sure that the facts are laid down on the table and people understand properly, what the situation is. Here's a quote here from the UN Secretary General. Again, this is quite obvious. There is one thing that worries me a lot, which is not really talked about, even though everybody realizes it, is the aging of the population. And I have a few more numbers in the following slides. But you're all familiar with China and the one-child policy. And you look at the China population pyramid, it's now completely reversed. It's literally completely reversed. So you think of how are they going to cope with the aging of the population in China, knowing that chronic diseases tend to really start, from age 60 and 65 and beyond. So there's a tidal wave of people that are coming into that segment. And quite honestly, today, if I'm the Chinese government, I would be deeply worried about that issue. One of the countries we don't talk much about, but one of the fastest aging countries in the world is Brazil. And everybody thinks of Brazil as one of the BRIC countries, but you look at the aging of the population in Brazil is also very, very significant. So I think you have that state today of those diseases, but then you have the second time bomb, which is the aging of the population, and that is something that will have to be addressed. In the West, we all struggle on how we're going to pay for healthcare because of the aging of the population, but we at least have some systems in place to manage that. In most of these developing markets, the systems are not even in place to manage that. So I think it's going to be, a huge issue. So some of the statistics, and I believe some of them were already presented before, so I will go quite fast on this one. But if you look at the third bullet point on this slide regarding about the cause of global mortality, if not addressed, the NCDs will account for 75% of all death globally by 2020. The total number of deaths we're looking at that time will be around 58 million people. at that year. Okay. We also know that we're talking about the aging of the population, that in developed markets, 25% by 2020, 25% of the population will be above 65. In the developing markets, it's 12%, but that number is rising much more rapidly than it is in developed markets. When you look at the economic cost, and these numbers are just staggering. And this is why I'm saying the issue to NCDs is really a big economic issue. It's not a healthcare issue. You look at these numbers and the fact that just between 2005 and 2015, more than $1 trillion of economic impact, economic cost, will hit just those three countries, China, India, and Russia. And we're 2010, 2011, and we think that about 50% of that cost is ahead of us. So about 50% is behind us, 50% is ahead of us. So these are enormous costs to contemplate. If you continuing on this topic, the threat to development. The organization in Europe called EUCOMED, some of you may be familiar with EUCOMED. It's the equivalent of ADVAMED, but for Europe. I believe there are the people that came up with that sentence a few years ago saying, health is wealth. Okay, and I think this is very important to understand that when we look at economic development. So the UN Millennium Development Goals, they are critical, but yet, there was nothing mentioned in these Millennium Goals about chronic diseases, and we think this is a huge gap that we need to fill. Therefore, the UN meeting in September. If you look at in developing nations, today, NDCs represent less than 3%, of the spending to combat that. Again, this is when you think that the cost is above 60 and 70% and only 3% is spent managing that, there's a huge gap that we need to address. The lack of guidelines, and training on NCDs, on prevention and treatment and management is a huge issue. And this is why, again, the forums we have and the discussions with the UN and the discussions we had in Davos 2 weeks ago are very, very critical. The necessity to establish guidelines to treat chronic disease is a major, major first step. At the same time, to get to an agreement, as you know, on guidelines, especially when it comes to medical treatment, is very hard, even just at a country level or even within, at times, professional associations. Guidelines are very hard to arrive to. So I think, a critical first step is really understanding what those guidelines are and have an agreement around them. Without that, a lot of time and money will be wasted. From a high-level meeting, so we have the United Nations meeting that will take place in September. I can't tell you how pleased we are to see the agenda of NCDs brought to that level, because we as we said many times, this is a problem that concerns every single country on earth, that has a huge global economic impact. Some countries look at that as important as global climate changes, whatever the argument is on global climate changes. I think there is little argument on the fact that the numbers speak for themselves when it comes to chronic disease. There is growing support from key stakeholders, and again, Stephen, we really, really appreciate the leadership role and the forum given by CSIS to allow us to speak publicly about this issue. I think this is very critical, and an organization like yours that have that type of credibility, that get engaged, is very, very important to bring about changes. The World Economic Forum, let me just touch upon that for a second. Again, I was in Davos 3 weeks ago, and there was, chronic disease was one of the key items on the agenda, and there are a lot of companies and a lot of NGOs and a lot of governments that are really looking to move along and have an impact on that. There is a partnership, for example, on how to better manage innovative healthcare delivery systems throughout the world, particularly in emerging countries. This is very interesting, and I will talk about that later on, because I think we need to look at managing NCDs from two different layers. One is at the global level, United Nations type of organizations, and the other one is, I would say, more at a practical level. On the ground, what are some individuals, what are some countries or some health systems doing today to manage those issues? So When we put all of these different stakeholders together, we know we will have an impact, and we can only hope that it will not stop there. Let me bring your attention to the third bullet point on that slide, again about strengthening and innovative healthcare delivery systems. The reason this is so important, I mentioned earlier on the example of India and the number of surgeons we have in the spine sector and for the cardiac surgery type of sector. One of the solutions beyond guidelines and getting an agreement with governments is how do we become really practical? How are we going to make an impact? Because as I said earlier on, very easy to boil the ocean, actually very hard to boil the ocean, but very easy to be lost in those very broad topics. And one of the things we want to do, and the Alliance really wants to play a key role, is let's be practical and let's take that down to some very concrete levels. And if time allows, I will share maybe during the Q&A some examples of what Medtronic does in that space. But using India again as an example, it's very interesting. Here is a country that has very limited means, and yet the amount of innovation you see in healthcare delivery platforms in India is quite amazing. And most of these things are done with very little money. And what's interesting is the people that start those initiatives, they don't do any market research. They don't have staff to tell them, the mortality rate in their neighborhood. They have an idea, they go ahead and they do it. And so one of the things that we're very keen to do, and the members of the Alliance, is to make sure that we have the two levels, the high level understanding on the size of the problem, the policy guidelines, the guidelines around the proper medical treatment, but at the same time find another level that is much closer to the ground, where companies, private sector, public sectors work together, NGOs work together, so we have a measurable impact right there on the ground. And again, I will share later on some potential examples on that. Let me just give you some examples here of what I'm talking about and some of the things Medtronic is doing. That first slide, I don't know if you can tell me what it is, but instead of letting you guess that maybe it's a train station or a metro station early in the morning in China, this is actually an outpatient clinic at 6 o'clock in the morning in China. Do we have a problem? I think we do, all right? We could actually multiply this by 100 pictures. And I've been in Chinese hospital, I've been in hospital in India, I've been in hospitals in South Africa. You go into the public sector, this is basically the normal state of affairs. Now, let's add a couple of things to that. And the next slide is about the same, it's slightly different. This is in a public hospital in India, less crowded, but some of you that go through these hospitals, you will see that. It's a very, very common view of the world, okay? And those systems, even today, are already completely overwhelmed, totally overwhelmed. They cannot cope. I'll give you an example. In China, if you go and let's say I feel I have little chest pressure, okay, and I can talk to it because I've seen it. And you go to any hospital, okay, and basically in the room where I have the consultation with the physician, there might be another 10 or 20 other people that have nothing to do with me that just happen to wait there. If I'm lucky, I will get maybe 4 or 5 minutes with that physician. And that physician probably will ask me if he thinks I need a pacemaker to make a decision right there on the spot about choosing a pacemaker. That probably cost 1 or 2 years worth of my salary. How can I be expected to make that choice at that time? And is that physician frustrated for being a job that really he cannot do in those conditions? Right? So that's what I'm talking about, the practicality of how do we solve those problems on the ground. And so we can, because what happens in China, and we know the statistics, about 90% of people that need a pacemaker walked right out of the hospital. So we have a leak rate of 90%. Well, you will never get to what we need to get to if these are the type of statistics we have, right? So in that context, what is Medtronic doing? And we have 3 key points here that we're going to talk about. First, of course, is the support of the NCD Alliance. Stephen, you talked about that, and we feel, we almost felt like we had no choice. It's not like we had no choice and we stepped in reluctantly. We stepped in very, very, engaged and with a very positive outcome. But again, we need to really have an alliance. As I said many times today, the size of the topic is just simply too big for one company or even one country to manage that alone. We have here some bullet points about the World Economic Forum, the private sector coalition looking at policy and regulatory reform. All of these are critical. What is critical, and that one message that we need to have regularly all the time, is how do we measure progress? And that is one thing that I think every stakeholders need to strengthen, to ask as we move along. And one of the key topics of discussion we had in Davos for the UN summit in September, what will be the measurement mechanism that will be put in place to measure progress against NCDs? The number two, our goal to strengthen the healthcare system's capacity to prevent and manage and control NCDs. Now, you may have heard before in healthcare, but I call them the 3 A's, the issue of access, the issue of, affordability, which is, as we know, really, really critical, and the issue of awareness. So all those 3 issues are something that Medtronic is really trying to address, and capacity build-up in that sense really goes to address the issue of access. So whether or not it's capacity build-up through education and training, okay, whether it's capacity build-up with programs we do. For example, we have some, programs with Harvard University and ourselves and the government of China on educating some, key physicians and hospital administrators. But again, this is not enough. As I said earlier, we need to change the delivery mechanism here. So whether we do it directly or through the Medtronic Foundation, through grants, we try to do a lot of that. There is a slide later on that I will talk. We have a patient care center that we have set up in China, which is another pilot. And that, when I was talking about how much time you spend in front of a physician in China. And so what we're trying to do is with this patient care center, is solve the problem of the hospital where the physicians never have time to even educate a patient on what the choice is in terms of good therapy. You have a patient that walks away that is furious because they didn't get what they wanted. There's one example that was not really published, but this is a true story in China where a gentleman needed a pacemaker. The pacemaker that he got was not a Medtronic pacemaker. It's irrelevant, by the way, to the story, but so they went and they gathered money, the family, to give the pacemaker to the father. And about 6 months later, the son of the family came back to the hospital, and you know what he did? He shot the physician dead. Do you know why? Because he claimed that, well, my father got a pacemaker, but he never feels anything in his chest, so it's a fake pacemaker. So think carefully about the implication of that. Nobody in that family was never educated about the fact that good, if the pacemaker doesn't do anything, that means the father did not need a shock. And there's nothing wrong with that. And if I had a shock, well, great, the pacemaker is working and your father's life was probably saved. So that son went and shot the doctor because he thought, that's a fake, I got robbed. So you talk about a lack of trust in the system. You talk about the need for education. These are, real concrete examples about the crisis that we face, and this is why, the involvement of anybody is so critical in that instance. Number 3, innovation, and I talked a lot about healthcare delivery innovation, but what is important is too often people think just drop the cost of a device or drop the cost of a pill. And that's important because the affordability, the triple A's that I talked about, affordability is a big issue. But that in and by itself doesn't solve the problem. The problem is understanding the ecosystem and creating new ecosystems to treat non-communicable diseases, to treat chronic diseases. Again, you look at the scale of the problem, unless you create new ecosystems, there's absolutely no way you will be able to solve that issue. So we are doing quite a bit of activities at Medtronic to try to do that, and I will skip for the sake of time to some of these initiatives that we're pursuing. In those creation of ecosystem, the need to also at the same time, come up with technologies that will do a couple of things. Drop the cost, which we know is all critical. Increase the access. In other words, take away the bottlenecks, the natural bottlenecks you find in the system today. So this slide is interesting because if you look at the evolution of pacemakers from Medtronic, the one on the bottom right, it's basically a pacemaker that doesn't have a lead. And you can see on the picture on the left, when you implant a pacemaker, we do what we call a pocket in the chest. We put the unit, and then we have to let the lead go to the right space in the heart, and that creates a lot of problems, by the way. So the next generation is just go to a simple pacemaker that you implant directly in the heart. There is no lead. So you have already taken some cost out. But what's more important, and I know some of our friends, EPs may not like that, but suddenly now you have a procedure that can be done by many more people. So the issue of 120 EPs in India that I talked about, suddenly now you can take that same procedure and now have 1,000 and a few thousand of people that are not necessarily EPs that can do the procedure. So you have eliminated potentially a huge bottleneck. So the role of technology remains absolutely critical in solving those solutions. But I want to make sure that people understand this has to be part of an ecosystem, not just a technology solution or price solution. And this is where the partnership is really, really critical. I talked about connectivity at the start. I think we're really, really fortunate. What technology is going in terms of wireless communication, the fact that most of our units today at Medtronic communicate on the internet, through the internet, and download data to the doctors 24/7, so the doctors know exactly what's happening to your pacemaker, for example, what's happening to your insulin pump is very important. But that's just a small part of the connectivity. So I think having a broad partnership with IT companies, with healthcare companies, with pharma or medical devices companies, with governments to deliver healthcare at a huge scale. And sorry, I didn't realize my slide went too far. To develop this connectivity is, in my opinion, one of the biggest upcoming revolution in healthcare. We have huge problems actually in our own countries because those systems are totally fragmented, and it's a nightmare to try to consolidate that under one set of standards, which, by the way, is one of the topics we talked at Davos. And talking about standards around healthcare delivery, this is one huge solution and one huge project that we are committed to try to do, come to common standards around IT for healthcare delivery. The good thing is, in emerging markets, you basically have no legacy system today. And so the opportunity to do that in emerging markets where the need is the greatest, I think, is a really, really real opportunity. And I'm sure that in 10 years down the road, the amount of time devoted to talk about medical devices or pharmaceutical products will be nothing, even though, don't quote me on saying that, because it's as if our industry is not important. But I think the talks will be really around connectivity. And that, I think, what is very important. And the next slide basically illustrates that. Let me talk about the Medtronic Patient Care Center, and maybe that would be my last slide, Stephen, before we turn the time over to you. I talked about earlier on the problem of having these people that go visit physicians and basically never have time to make a decision, and then they have to go and gather more than 1 year of salary or 2 years of salary to get the proper device. So what we're doing, and this is just a pilot, we have an agreement with the Chinese government and with one key leading hospital in Beijing to, when they have patients that probably are indicated for one of our therapies, they send them basically down the street to our patient care center. And what we do there, we don't sell anything. We just basically talk to them about the therapy. We educate those patients. Think of, if you want, as an Apple store, but it's a Medtronic education type of entity. And it's a very nice environment. And basically, we don't tell them about our own devices. We just tell them about chronic disease and what the therapies that are available on the market for them to choose from. And then basically, we send them back to the hospital. And hopefully, at that time, they're convinced that, it's worth for me spending that money, knowing that in China, it's still about 60% out of pocket. So this is one of the solutions. It's a small solution right now, but we're piloting that. And if it works, we'll have 200, 300 of those centers in China, and maybe the same in India. Again, one small example of how you partner with government, in that case, a public hospital and the private sector, to bring to the table a real solution to a real problem. So I will close my presentation here with those key takeaways. Again, nothing new, but this is NCDs. The impact of NCDs, you saw the numbers, is absolutely huge and critical that we understand the size of the problem, the size of the opportunity, the economic impact on nations, on development, on the healthcare of the people of the world. We have a unique opportunity to leverage the September, coming September United Nations meeting on NCDs. I think it's really fantastic to see that. It's great to have, as I mentioned, organizations around the world, to support that effort and help us in putting together an agenda, educate the general public, educate policymakers, politicians, healthcare administrators. So we will have, a platform for the next 10 years where measurements will be agreed upon and real activities will be led. The private sector, I think, is a huge part of the solution. Not simply because we have technology, but we understand a side of the healthcare and we understand a side of NCDs that is really unique. And we absolutely want to collaborate and partnership with all of the different stakeholders that are out there. So this is basically the essence of my presentation. And I think I'll turn the time over to you, Stephen. Thank you.
Thank you very much. That was really a wonderful presentation. Why don't we chat for a few minutes about a couple of the key issues, and then we'll open to our audience to offer their comments and questions here. I'd like to turn to a couple of key issues around that we confront here. One issue is, as you know, here we have a very dramatic budget problem. We have a split government. We have a fairly polarized environment. There's a lot of debate right now. And we also have a legacy that people across American political spectrum are quite proud of, which is what the achievements that the U.S. has made in global health in the last decade. And just this week, it was quite interesting to see that two things happened. One was the president brought forward his budget. And in his budget, quite remarkably, called for a $9.8 billion global health budget, $800 million above the level of the enacted budget for FY10. It was a very strong signal of the confidence and the value and of these programs and the fact that people are convinced that they still derive strong bipartisan support and deep support among the American people. Second thing that happened that was, but that does not include a large segment around the NCDs, although you can say that NIH has done some very important things in that area. PEPFAR the Office of the Global AIDS Coordinator, has started an alliance, the MEPI Alliance, with African universities that offers space for putting some resources in that area. There's an awareness and a consciousness, and those platforms, those huge platforms that have been created by the United States, PEPFAR, PMI, and now the Global Health Initiative that broadens into maternal and child health and other things. There's a lot of money there, and there's a lot of resources, and with some creativity, and we're starting to see that. There's a little bit of movement, but it's still, as you pointed out, 3% movements. But nonetheless, my bigger point is this administration remains convinced that the case can be made, and we've seen it in this. The second thing that happened was the First Lady, who leads our domestic Let's Move program, focused on obesity and inactivity and those risk factors that you know, announced that she really wishes to have this take on a more global perspective, and a hope to tie it into the maternal and child health orientation. So that's good too, about trying to market these ideas. But it all gets back to the question, in this particular moment in time, in the United States, what are your thoughts about connecting to a voter, to a congressperson, or to a citizen who's an informed citizen and who's a voter, who's really quite anxious about the state of affairs in terms of our budget deficit, our chronic, our slow economic recovery, and the sort of polarization that we've seen right now, because it's going to be very incumbent upon, in order to get the NCD agenda, to get the visibility, it's going to take leadership and it's going to take a smart approach in this environment to navigate this difficult environment. And so I just want to first ask you your thoughts about how that might best be done in the lead up to September and beyond.
It's a tough question. I think actually it's very interesting because we look, at the U.S. model with great respect for what has been achieved in healthcare in the U.S. and at the same time a level of anxiety because we say, if the U.S. leads the way in terms of healthcare, everybody is going to follow in that route, and we know this is not a sustainable model because simply of the cost and what countries can afford around healthcare. You raised one point, Stephen, about the connectivity between the voter and did you say the congressman or I'm not going to get into the working of the U.S. political system around healthcare, but I think one point which is critical, and Medtronic, just like any other companies or insurance companies, were very much involved in understanding, for example, the debates around Obamacare. I think there are two key points. One is we are wasting so much money, and there are a number of statistics today that show that there's so much money wasted in the U.S. system in healthcare. So while it's an outstanding system, and if I would ever have a real health problems, I would want to be treated in the U.S. I could go to my home country in France, but I would probably choose the U.S. Because of the advances and the expertise on that. At the same time, we can see it from our perspective, the incredible amount of waste there is in the system. So to me, number one is do we find a way, and it has to be nonpartisan, do we find a way to really talk objectively on how do you streamline the spending and take the waste out? Because you're talking hundreds of billions of dollars over a period of time. Number two, and I don't know if this is really what you're getting at, Stephen, is what is the role of the individual in that debate? And I think back to the issue of education and the ability to make choices, I fundamentally believe that you cannot have a system that takes away the choices from the individual, what they want to do with their health and how they want to manage their health. So you have to find a system that gives, options to choose from. We know those options have to be limited because if they are limitless, then the cost is absolutely horrendous. So, is there a political will to have a limited number of choices that make sense, that medically are good, but allow for people to decide for themselves what is the best care possible, then I think that is clearly the way to go. The first thing that I would say, which is true of any countries in the world, you need to take the politics out of healthcare. It's very difficult to do, right? And I don't know if anybody knows how to do that, but you need to take the politics out of healthcare to have a debate that is objective and drives to actual solutions. So I'm not sure if I'm answering your question, Stephen, here, but this is how I would look at it.
Yeah, that's very helpful. I mean, my personal view is that I think that being able to come forward and say that to the American public, yes, we have these problems, but we also have considerable knowledge and expertise that can be of great value in other settings. And your point about we're entering a period where there needs to be connectivity, new discoveries, more affordability, and the like, and an integrated approach, that the private sector plays a key role, that we have these achievements that we've already put in place, these foundational programs that give us all sorts, that people are proud of, that give us all sorts of opportunity to engage and bring other broader benefits, and that this is key to economic growth. That your point,
Absolutely.
Your very powerful point about the economic burden. And we as a society know we're globalized. We know that our slow economic growth is tied to a broader global problem of restoring economic growth and preempting things that may become a huge burden on individuals, on societies, and on economies. In terms of making the case as we head towards September and elsewhere, it's going to be very important to have that for the emerging markets, for China, India, Brazil, and for lower income countries that also face this galloping phenomenon of NCDs, that there be a face, and that there be more than one face, that there be leadership. I mean, when the transformation happened in America on support for HIV/AIDS programs, which jumped from, in the 90s at 140, 130 million per year to today, which is 7 billion per year, the transformation was triggered by many factors, but not the least of which was having a President Obasanjo, or a President Museveni, or President Diouf, or today Minister Theodros from Ethiopia. Where are those personalities now, in your view, who from emerging markets, from low-income countries, who can give us that political momentum and edge in trying to make the case? Because I think for that informed voter in America, that is a terribly critical dimension.
This is a great point you raise, and maybe I'm going to use concrete examples that you may have read in the press. Actually, I'm not going to tell you these are the people that are the movers and shakers, because the list is very long, but I'm going to give you some concrete examples, and you see that now happen, the famous medical tourism issue. And today you have even some U.S. medical insurance companies that will pay for someone to go abroad, get a procedure done at a quarter of the cost, right? And you see this medical tourism, develop all over the world. Now, there's a cost-driven reason for that from, developed countries to emerging markets. But what's interesting and what really is not really understood is it's also a quality at times. It's not just a cost model, it's a quality model. You look at some of these physicians in some of these countries, they're just as qualified as anybody else in the West. But they approach a procedure, or they approach a recovery program completely differently. So lies to me a very interesting paradigm. Today, if you take, for example, the best known companies in healthcare, I can tell you that in 10 to 15 years from the West, half of these companies will have disappeared, and you will get names from India and China that nobody knows today. I happen to be familiar with some of them, but they are not under the radar screen today. But the way they approach the delivery of healthcare is so fantastic. You have some of these eye clinics in India where they do more cataract surgeries per day than the largest hospitals do in 1 year in the US and the UK, and they do that for 1/10 of the cost. And the patients that come out of there have just as good of a vision as anywhere else, but they have found a system where it's highly efficient, very high quality, access is done, affordability is taken care of. We are not having those models in the West. Okay, so I think to the point you are taking is will we be able to import from those countries, those new healthcare delivery models, to put that in place in our countries? And I think the train has left the station in a way. This is inevitable. It will happen. And so while we need to reform our own healthcare system, cost, waste, and all that, the reality of the marketplace and the fact that you can get today in some of these countries, top-notch healthcare, top-notch procedures and surgery done at a fraction of the costs, inevitably you will see that shift. So that's what I'm saying. I'm saying look at, instead of talking about a few people and there are again a lot of people, but look at what happens in how people manage chronic diseases in some of these markets. Necessity is the mother of invention. Well, it is true. And we're going to have to see those models imported in our countries.
Thank you. Just one question on the practical political issue around getting a successful outcome in September. 10 years ago this June, when the UN special session on HIV/AIDS, the UNGAS session, General Assembly's special session was held, that was a historical moment, and it was a turning point. And there you had a Peter Piot figure. You had a personality who was able to bring the pieces together, to have voice, to leverage political leaders, to leverage a variety of different places. Do you think we should move towards that model? Do you think that, because right now we have, what are the assets to move this forward? We have a Secretary General, Ban Ki-moon, who's on record, who has a huge stake in the success. We have Margaret Chan, huge success, very powerful and forceful advocate. We have the NCD Alliance. We have corporate leaders like yourself. But we don't have a personality that is doing this day in, day out, that has the respect and command that can do that. And I'd like to know your view.
This is a great point. Actually, it's a point that we discussed at Davos quite extensively, because you're right, indeed, there's not one single person that does that, day in, day out, that has the knowledge and also the credibility to do that. So we have a large group of stakeholders that all realize, the impact of that. And so between now and September, I do not know that we will have such a person that can devote that time. I mean, Bill Clinton is very much engaged. The Gates Foundation, even though they really spend more of their money on infectious disease, we have had meetings with them, and they also realize and that, this is another major. So whether or not that will be a quote-unquote liability in terms of carrying the message forward and making sure things happen, I hope it will not be one. But right now, I cannot tell you if there is somebody that can step up and say, I own this, or I've been asked to own this, right? Yes. And so I don't know if this is a liability or something good. I would personally love to see someone, as you mentioned, clearly own that has, the credibility to move that forward. At the same time, there is so much, engagement and understanding of the crisis at hand, and with people and organizations and government that really understand what's at stake, that I believe there's a core group of people, and probably more advanced than what it was 10 years ago, So this is now the other side of the coin, right? That there's more data gathered, there's more understanding of the crisis coming up. We know exactly what those diseases are, even though we may discover new ones. So you may not have that personality up in front, but I think the foundation is more solid than what it was 10 years ago.
Thank you. Why don't we move to gather some comments and questions from those of you who've been so patient. What I suggest we do, we have some microphones. Just put your hand up. We'll take in groups of 3. So Sam, Sally, and over here, sir, I'm sorry, I don't know you. Let's just do that in quick sequence. Then we'll come back after we've done 3. And please identify yourself.
Samuel Udeni Jones from HHS. Thank you for the plug on Medtronic. If you asked me 2 days ago whether Medtronic would be leading this charge, I would have said, no way. So I think you've done a good job. Well, that 2 points, they will address some of the issues that Steve mentioned. One is to bring to your attention that SADC countries, especially South Africa, Mauritius, have been making this case for a long time. I happened to fly in a plane in 2006 with SADC ministers of health, and they were telling me that NCDs, diabetes and cardiovascular diseases were their principal problem, and I didn't believe them then. And I remember one of the ambassadors, U.S. ambassadors of South Africa, went to see Mbeki, and he thought, well, I'm going to tell Mbeki we're spending $600 million on HIV, and Becky told him, thanks for all that, but we have a bigger problem as NCDs. So I think if you're looking for leadership, I think you'll see very good, willing leadership from that, both at the presidential and ministerial countries, the SADC countries. And to address the second issue, what is it that gave the impetus with HIV and the other infectious diseases? Apart from the leadership that you mentioned, the second factor was that we were able to make a case that we could put together a package of interventions, a clear package of interventions, which in a few years would lead to measurable outcomes. You remember HIV was 2710. It was quite clear that President Bush probably would never have done it if he didn't agree to 2710. So the question, are we in a state now where we have that sort of package of interventions and measurable outcomes so that we can show in a few years that we're making some progress?
Yeah.
Can we just hold
Sure.
one moment? Right, two rows back, please. And then we'll come over to this gentleman.
Yeah, thank you very much. I'm Sally Cole from Population Services International, which is an NGO, been working in social marketing for a number of years, meaning providing products to low-income people that improve their health, mainly through the private sector. In the last few years, we've had some very good experiments with franchising private clinics in the developing world as well. And I wonder whether you think that your expertise in this area about the Medtronic clinics and so on can be sort of extended beyond the Aerovans to get things not just sort of demonstration, wonderful projects, but really taking advantage of the fact that 50% of the poor people already get their health through the private sector in the developing world for exactly the reasons that you've mentioned. These slides you show of the hospitals, the public hospitals, are overwhelmed. How can the private sector and the governments work together to improve the kind of healthcare which is delivered through these clinics that are already on the ground, already providing services, but now not really working on the NCDs, focused on reproductive health, HIV, and other things? Thank you.
Great question. Sir, over here.
Edward Kadunk. I'm the president of the Pan American Health and Education Foundation. It seems to me that this disease or group of diseases has an important difference from challenges that we faced in the past, and that's the real need for a very high level of involvement from the private sector, both because private sector produces many of the treatment products, but also because it produces many of the goods that go into the mix of causing chronic diseases. And if you add to that the individual responsibility, which is going to be necessary on the part of each person in order to change their lifestyle, as you pointed out earlier, I'm wondering how we bring that mix together in a way that's productive in dealing with the disease, particularly when a lot of the international organizations that have the responsibility in this area have a real reticence about working with the private sector.
Thank you. Thank you for the three questions. I will answer them in the order in which they were raised. I'm very much aware of the fact that many of these countries have indeed made the case before. The good news, even though it may be somewhat late, is now there is an understanding, a global understanding of the scale and the size of the crisis. I think your question, your last point about what's in the package, right? On how we're going to measure that. Trust me, this was a topic of intense discussion in Davos, and we really had people from a very, very good broad representation of all the stakeholders worldwide at the table. We had 3 different sessions to talk about that. One of them led by Victor Tsao, who is the president of the Duke healthcare system, who knows emerging markets very, very well, and for public disclosure, he's also a member of the Medtronic board. But he forced, we were divided in groups and said, give us solutions and give us measurements. So the first key point and the timeline is very short. To get to these agreements between now and September is very, very tight. You understand that. But at least the realization that we need to come up with standards, okay, is the first step. And whether or not by the time the summit comes in September, we will have this nailed, I do not know. But I can guarantee you that there is total will and alignment to know that this is where we need to start. The private sector, as you know, wants to get involved, but private sector, being the private sector, one of the first things we ask is what are the measurements? Because if not, it will be a tremendous waste of time and resources. So I think everybody is keenly aware of the fact that we need to have, scorecards, if you want, metrics and measurements, so we can measure progress. But more than that, we understand what works and what doesn't work. Because right now, there are so many potential solutions on the table, we're going to have to make some choices. And you cannot make the choices without the data in the first place. And then you cannot make proper policy and choices if you don't have models where you can measure the outcome of the input, so to speak. So again, I hope we'll be ready by September. If we're not, I think it will be a matter of time, not a matter of will. And I think that's the first part. The second question, Sally, I believe, right? You talked about, how do we in a way, franchise some of these efforts. There are today, again, a tremendous amount of innovation going around the globe, in emerging markets on these innovative ways to deliver healthcare. One thing that is very important, and this is, let me try to explain. Everybody needs to understand what is the value proposition that is put forth. And I'm not talking value proposition in terms of profit. That's not what we're talking about. It's the value proposition for the local government, the value proposition for the local healthcare delivery system, the value proposition for the private sector agents that get involved in that. So you need to understand what is the value proposition, what is basically what you are trying to do. And if you can understand and define that value proposition, and show that for each of the stakeholders they can indeed have an impact, then you have a model that works, that can be duplicated. I think in terms of chronic disease, one thing that we have found, and this is why I was talking about awareness, affordability, and access. The lack of awareness around chronic disease is staggering. The example I used in China, that person shooting dead surgeon, shows you how the awareness and the understanding of the issue at hand is below zero, if zero is the base we start from. So I think the need to educate people, just like there was the need to educate people around HIV, this is even bigger. HIV back then was kind of defined to I want to say a narrow sector of the population as compared to NCDs, right? So the need for education is tremendous, and this is why I'm very, very keen. I want to see a way where we can, as I said earlier in my presentation, how do we change the way we deliver education around chronic diseases? Because the system today will never get us there. So that is critical. And then once we have that in place, I think the ability to duplicate those examples, or those franchises, if you want, is something very important. Victor Tsao and Medtronic is involved in that at the World Economic Forum, is putting together, again, an alliance. And it's called the International Partnership on Healthcare Delivery System. I think that's what it is, Trevor, right? And so there's a group of companies that are getting together where we are going to help call them young entrepreneurs. If they have a successful business model, we think it's going to work. We're going to help them, go and duplicate that in their city or in their region or in their country. So there's a lot of activities, and that to me is a huge, almost unseen part of solving the problem. And Edward, the question, if I recall, if I wrote that correctly, was, how do we bring all of these different stakeholders together? And I think you added a point, knowing that there is a level of skepticism around the private sector involvement, right? I think that was, and yes, indeed, there is a level of skepticism around private sector involvement, and we know that. And part of it was created by the private sector. We kind of created our own wounds there, but I think today, again, in Davos, we had several people involved, and the Secretary General and Margaret came to some of our, discussions, and I think people realized, again, the size of the problem is so big, and there was clearly, clearly a political will to work together. Margaret was very clear. She said, look, private sector, you have a very bad reputation out there, okay? And, for those of you that know Margaret Chan, she's outspoken, and it's good. And so she was very clear, saying, look, the WHO will get involved only if we see the private sector is credible. I hope that, doing what we did today shows that the private sector is credible, because we absolutely want, and we know we have a role to play in that sense.
We have an opportunity to take some additional questions and comments. While you're thinking about that, yes, David?
Thank you. I'm David Jocelyn. I'm advisor to the Chicago Council on Global Affairs. A topic that's of interest to us is the effects on the agriculture sector of massive changes in diet. Mentioned in your paper, Steve, moving from an unhealthy diet as it relates to these diseases to a healthier diet, whether the agriculture sector and the food processing industry is prepared to deal with that. Not just deal with it, but contribute to it, help with it, facilitate, not just react to that movement. We're concerned that a massive movement in that direction may put demands on the agriculture sector for land water, technology, investment that the sector is not prepared to make. So a big question is, what role will the private sector play? There was a lot of discussion, I think, about it at Davos, and the global food situation is a big issue. But in terms of a healthier diet in the context of these diseases, do you anticipate the private sector, the food-producing private sector, to be helpful, resistant, part of the solution, and part of the problem as we go forward?
I think. Did we just want to do one?
Sure. I have a follow-up on that.
Okay, let's wait then. Yeah.
Hi, Adam Sloat from USAID. At least within USAID's Bureau for Global Health, we have a long history of working with for-profit private sector, and we found it to be extremely valuable in the sense that certainly profit is a very important motivating factor for achieving scale and long-term sustainability, and if we can find a win-win situation, it's something that we actively try, a relationship we actively try to pursue. And when it comes to NCDs, it's easy to see potential profit for companies that will address NCDs, for instance Medtronic. It's less easy to see the potential profit for companies who might be involved in preventing diseases, and that's why I raise it in the context of the last question. From your perspective, which aspects of the private sector might actually stand to gain from preventing NCDs? Seems actually there's a potential for a lot more companies, for example, tobacco companies, large food companies, etc., to actually stand in the way potentially of prevention. Is there an aspect of the private sector that stands to gain from prevention?
One more question then, yeah.
Hi, I'm James Class from Merck, and I'll be transparent that we certainly stand to gain from prevention. As you know, we know a thing or two about vaccines, but what I really wanted to ask was about incentives. And you talked about some of the incentive discussion at Davos, but I'm thinking too, especially in other countries, even here, about incentives for individual people. When you have a large private sector insurance systems, insurance premiums are one way that you can have an incentive. Employers can do things to create both positive and negative incentives. But when you deal with a vast number of people who are kind of outside the system of either, being employed by a multinational corporation or having good insurance, or say even having gyms, how do you get them to exercise? How do you get them to have abundant fresh vegetables that, might just not be there? and so therefore, with a lot of these things that, really contribute to the risk factors, are there other ways or incentives we can find that really apply to people that don't have a lot of the institutional things we take for granted? Thanks.
Thank you. Thank you for these for those three questions. The first one on the role of the diet and the agricultural sector and the role of the food industry. Again, that was discussed at length at Davos. Again, Margaret Chan was very vocal with the representative of the food industry that were around the table. Ken Powell from General Mills, CEO of General Mills, was there and led actually some panel discussion, but was very much involved. And so I'm not talking on behalf of the food industry, but I'm going to tell you what I'm hearing and what I heard. Companies like General Mills have been quite aggressive in really going through a methodical way of changing some of the requirements and some of the ingredients they put in their products. Reducing sodium, reducing sugar, looking at looking at different type of raw material to put in their food products. They are very much aware of the fact of the link between some of these diseases and the food intake that people have. They are very much aware of the fact that the changes in diet in the developing world is almost taking a lot of people by surprise, and see how fast, diets that used to be, one way just over a period of a decade or less at times have completely changed, right? For any of you that go to these countries, you can see the proliferation of fast food places, and it's scary to see that in a way because, almost overnight, at least in one generation, you go from, maybe rice and vegetables to, fatty food and a lot of sugar and a lot of salt and all that. So the food industry, I think, has two things to gain from that, and I think their role is critical. First, the global supply chain, and to go back to, I think, part of the points that you mentioned, where people actually, the reach of the food industry in the agricultural supply chain cannot be misunderstood, and it is really far-reaching. And they understand also the issue of sustainability, the issue of water usage and all that. So I think they have so far put together in place plans to address some of these issues around diet, around the sustainability of the agricultural development in those developing countries. There's still a tremendous amount of work to be done, but at least what I've heard in Davos was a very strong willingness to work with, particularly with the WHO, on standards, on nutritional standards. So we avoid, if you want, the mistakes that the Western world has done on the type of diet we choose. But still a very, very long way to go. In terms of, the issue on profit and who is to gain, from prevention, I think it's very simple. Everybody has to gain from prevention because the risk of not addressing these, the total cost to society is enormous. Nobody can afford to let chronic disease go unaddressed so long. And even though I could say, well, I'm here to treat chronic disease, we also are heavily involved in the diagnostic and the prevention of chronic disease, and of course the pharmaceutical companies as well. So I think almost all stakeholders, if they understand what's at stake and they understand that we are trying to change the nature of an ecosystem that is going to be impossible to manage, everybody will be able to adapt either their research and development, their business model to address the opportunity that, in a way, we have today. It's an opportunity within a crisis mode, of course. The profit motive, yes, it is essential. You mentioned that. It is essential, but I think here, I don't think, at least I've not heard, I don't think anybody here is driven by a profit motive. I think here people are driven by finding a solution within which they can find, a new area of business for them. But I tell you, we spent a week together in Davos. I've not heard anybody saying, well, you know what, my profit margins are going to erode if I do A, B, C, and D. Nobody, even though maybe it was not politically correct to say that, even in private conversation, nobody said that. So I think I'm not terribly concerned about that, even though it is, something that everybody is going to look at. And not only private sector, governments have to look at that. Call it balanced budget, but balanced budget is a profit, behavior, so to speak, in a different context. The last point was the incentive. So this is interesting, the incentive for individuals, and this is where there's still a tremendous amount of education that needs to be done. Someone at Davos that runs a very, very large company in the healthcare field was saying, well, look, our company, we have tracked the positive impact of walking 20 minutes a day. People that walk 20 minutes a day, we can track the fact that, they lose weight and, their cholesterol improves, and, there was a whole list. And so the proposal said, well, we need to give incentive to these people to walk 20 minutes a day. This is why we have a huge issue for education. Think of these poor women that have to go get wood, every day, and they don't walk 20 minutes a day, they walk 5 hours a day. And their health is not improving because of that, right? So I'm using this example that, to me, the incentive here is the economic development. Because again, when we look at, you don't address that, just the three examples of China, India, and Russia, $1 trillion, during that period we talked about, of lost opportunity. The opportunity cost of not addressing chronic disease is $1 trillion for those three countries. So to me, right there, the incentive, there's plenty of incentive for anybody that is involved, to see that we change the system. This being said, there's also the practical aspect of bringing people to action. Because one thing we have noticed, even in our education programs, and even with the patient care center that we have in Beijing, and again, we're just 10 months into trying that, it's kind of, I'm going to use an analogy, good advertising will create a call to action by the person that looks at the advertising, and that they will decide to go get the product or something. Well, there's a call to action we need to have here in terms of changing behavior, whether it's just diet, whether it's walking 20 minutes a day, whether it's accepting to go to see your local clinic, whether it's accepting vaccination. So the call to action here, we have to be practical. And there are, in the pharma world, I know in Africa, there are some very simple incentives people have put in place, and the correlation is unbelievable. If I recall correctly, and I'm not sure which pharma company, it's not Merck, however, I know that, but to have those women take their babies for vaccination, they give them a bag of 1 kilo of flour. You know what? What's the cost of 1 kilo of flour? It's nothing. But the correlation between those that would get that 1 kilo of flour to go get the vaccination, those that did not, was unbelievable. I mean, it was like from no acceptance to the treatment to almost a 90% acceptance of the treatment just because they wanted to get the bag of flour. So, again, it's back to understanding the big picture, but also be practical at the ground level, because there's a lot of that can be done.
We're getting here towards the end. Why don't we take a couple of final questions and comments, and then we will adjourn. Yes.
Hello, my name is Fatoumata Bachili from HHS. My question is, for those who are fiercely independent and don't want to be told by the government what they want to eat or drink, and we have seen the commercials on TV, how are you going, maybe the private sector can take that role, and how do you see that role? Thank you.
Over here.
Thank you. Michelle Ledgerwood with CSIS. I have a very quick question along the lines of practical measures. My background is actually in medical informatics, and I was very struck by your comments about the connectivity and the criticality of using various forms of connectivity for collaboration and also for the delivery of medical education. But if you look at a lot of countries, and I'm thinking in particular of African countries, the IT infrastructures there are fragile at best, and a lot of the connectivity and a lot of the communications actually take place via the mobile telephony infrastructure. And there have been some innovative NGOs and private sector corporations that have undertaken some fairly successful attempts at delivering the kind of NCD-related medical education you describe via text message and setting up patterns and infrastructures in that way. I was just curious if Medtronic had what work or what investigations you had done in the realm of mobile phone healthcare delivery. Thank you.
Thank you very much. The first question about those fiercely independent people, were you referring to any part of the world in particular, or the US? Okay. Well, here's a Frenchman that is going to make comments on the US. I don't know if it's good or bad, but I think in that case, I realized there is, for some part of the population, a deep distrust about any government-led programs. I think this is where the community needs to come into place. And it's interesting for me, again, observing the US from the outside, so to speak, to see the role of the community in which we live. And the US has a tradition, I guess, of having very strong community involvement in different social causes that you almost don't see that much in other, at least developed countries. So I think if these people don't want the government to be on their back, it's their right. What can the community do locally? Short of that, I'm not sure. I've never thought of that question, which I think is a great question, but I don't know what else. You simply cannot force people into doing something, no matter how good it might be for them. You simply cannot force them, right? So I would say the role has to be at the local level in the community. That's what I would say. I could not see her there. Sorry, no, that's fine. That's fine. The role of connectivity. So has Medtronic done anything to address that from a healthcare point of view? We are in discussion with several potential partners to see, because again, this to me, and I'm just going to throw names, not for endorsement purposes, but just top of mind, but this is where a Cisco system or a Google or an AT&T or Verizon or some companies in India need to form an alliance on how we're going to take care of the delivery. I'll tell you something that we have done in China. Now, this is interesting. We did that internally to see how good it would be, thinking of potential application for rural China. But all of our HR messages to, we have about 1,000, employees in China. All of our messages, everything we do communication with employees is through the cell phone. There's no more email, there's no more faxes, or everything is on the cell phone. And it's amazing how effective it is. So we know that, it's quote unquote, it's easy. It's a tool that people can respond to. And we did that again in anticipation of how could we really reach those hundreds of million people in rural China for education purposes. So we know that at least with our employees, it works perfectly. The key here again is our ability to bring people together and find the right alliances and the right partners to do that on a worldwide scale, and include, mainly for content purposes, people that are, extremely credible in that field. So our association with Harvard, and we have association with Harvard and other leading universities, it would be the type of people would bring to the table to assure that content is fair, objective, and so forth.
Well, I think we've come right up to 11 a.m., so we're actually on time, and we've covered an enormous amount of ground. We're very grateful to you, Jean-Luc, for taking so much time and covering so many of these issues. We're also grateful to you and Medtronic for the leadership you're taking in getting us ready for September, and we hope you'll come back after that September session and give us a debrief on how things went. We will be actually pulling people together in September afterwards to take a look at the outcomes and the next steps. Please join me in thanking our speakers.
Thank you very much. Thank you for your question. Thank you, Steven. Thank you.